This week is Hospital Week, so a good time to remember that the responsibility of making sure patients stay safe and stay healthy goes beyond just doctors and nurses. There are dozens of vital roles that allow hospitals to thrive. So joining us now to talk more about these lesser-known roles, we've got David, we have Rachel, and we have Sarah, all from HCA HealthONE Aurora. So I think we should start with your positions. So David, what do you do?
I'm the Director of Chaplains.
Okay. Rachel?
I'm the Associate IT Director.
And Sarah?
I'm an Assistant Director of Supply Chain.
Let's talk about key responsibilities. Again, this is Hospital Week. We wanted to shine the light on more than just the doctors and the nurses. You all have an opportunity here to talk about some of your key responsibilities in these roles.
Yes, my job is to support the patients, their family and friends, and the staff in just, you know, there's just so much that happens when you're in a hospital that's life-changing events, and we can try to support people through those processes.
I mean, sometimes in very difficult situations.
Very difficult, absolutely. And a lot of people we're with are in their worst days of their lives, and we're just trying to help them, and as a whole being, body, soul, and mind, yes.
Rachel, let's talk about what you do day to day, day in and day out.
Yeah, so we have a team of 9 techs that support our facilities at Aurora. We do everything from the basic of break fixes, where a nurse is charting at a computer and something is malfunctioning. We go in there and correct it, to all the way of what new technology can we bring into the facility that maybe a surgeon is wanting or one of our other physicians is wanting to help provide that patient care. And then, of course, everything in between.
Sure. Sarah, you probably get this question a lot, right? Like, what exactly do you do?
We do get that question a lot. So we have a team that goes across our 4 campuses, and we are responsible for making sure all the supplies are there for all the clinical staff, for all their things from anything in emergency to procedures to taking care of the patients on the floor, so that clinical staff doesn't have to worry about something, and that they can take care of, and patients have a great outcome from staying there. So.
I don't know if you all want to try to tackle this one, or at least one of you, but there are always rules and regulations that are changing, right, within the healthcare industry, things you have to stay on top of. How can that affect what you all do in the hospital setting?
Yeah, I'll start. So from a supply chain perspective, we have a lot of shortages we have to deal with in finding substitutions and making sure that we have products that are safe for our patients, things that are recalled. So that's a daily thing that we manage, and making sure that we have good safety outcomes, patient experiences. So definitely something that happens.
Yeah, even from an IT perspective, there's a ton of threats out there too. So how can we be actively monitoring that to ensure that our patients' information is safe, our colleagues' information is safe, while also making sure that we're behind the scenes and we're not directly affecting that patient care, and our nurses and clinicians can provide the best care possible for them.
One more question I do want to ask, and I want to make sure we have time to answer, hear from all 3 of you, is what would you say is the one thing about your job, about your individual role, that you wish patients or just the people in general knew about?
That's easy for me. There's a lot of stereotypes as to what a religious person in that setting might be doing, and I'm not trying to do anything to you. It is a supportive role. It is based on questions, based on hearing how you understand the world and how you make sense of things, and coming alongside your own process rather than pushing anything onto you.
Makes sense, right?
Yeah.
Rachel, how about you?
Yeah, IT is just really cool in a hospital setting. It goes anywhere from just the basic computers all the way to the cool functionality you can have in an OR or a procedural room. So I actually geek out quite a bit on the cool technology that we get to bring into the facilities. So that's something I think people don't really hear about too often.
Sarah, we've got about 15 seconds for you. Think you can squeeze it in?
I can squeeze it in. So I think for us, there's a lot behind the scenes. You get to work with all different departments, the clinical folks. You learn a lot of clinical knowledge, and you really do have an impact on the outcome of that patient and seeing the happy lives that come out of the hospital.
We appreciate all 3 of you coming in here for Hospital Week.